Welcome to After the Bell podcast with your host, Lauren Cranmer. We are on episode 5 this week, and we have a very special guest, Nicole. She has been through an insane journey. She is a Hodgkins Lymphoma survivor, a CML leukemia survivor, and all while going through this, she was going through fertility issues, and then she was pregnant with her leukemia. And there's so much more to her story. So I am super excited to get that out there for somebody who needs to hear it. And Nicole relied heavily on her faith throughout her experience. And I think it's a testimony to what people going through cancer really have to do to get through to the end and beyond, because cancer doesn't really have an end. The treatment might end, but cancer stays with you. So please welcome Nicole with me, and I really hope you enjoy this podcast. Welcome, Nicole. Thank you so much for being here. Tell me a little bit about yourself. I'd love to learn a little bit more about you and, your reasoning for wanting to share your story.
So I am 30 years old currently, but I was 24 when I got my first diagnosis. I grew up in New York, and then I came to Pennsylvania for college, and that's where I met my husband. So I just kind of stayed here. So like we were talking about what you were saying with being pregnant while going through treatment, my infertility is very closely linked with all of my cancer diagnoses. And so I just found that really unique and interesting. And that's part of the reason why I wanted to come on and talk about it. So my husband and I met in 2014, engaged in 2015, married in 2016. And we decided to wait a year before we started trying to have kids, just because we didn't want the stress of it. We wanted to enjoy being married, but that was both on our hearts to have a family. And so I knew from the beginning that I was probably going to have trouble having kids, because my mom, it took her several years to get pregnant. And then also my periods were always just super irregular. So I knew it was going to be difficult to begin with. So I started seeing a fertility specialist pretty early on in the process, which I felt weird about, because I know you're supposed to wait a year. But she said I did the right thing because I had a reason to come see her. It wasn't like I tried for a month and couldn't get pregnant, so I came in. Around that time, I was like, I should just improve my overall health. So I went to see a chiropractor. And my dad's a chiropractor, so I know that helps with overall health. And he was just doing like an exam of my body, just kind of like getting used to it. And he felt my neck, and he felt a lump right here. And he said, oh, it's probably just a fatty tumor. I would get it checked out. I was like, okay. And if I was not trying to get pregnant, I would not have done anything about it, because I was just one of those people who was like, oh, it's fine. I'm fine. I'm not going to worry about it. Yeah. Exactly. So, but because I was trying to get pregnant, I was like, this is kind of near my thyroid-ish. I should get it checked out. So I called the fertility specialist, and she got me a CT. And like a day or two after the CT, I got a call from her on the drive home, and she said, so I have the results from your CT. I was like, okay, great. And she said, what are you doing right now? And that should have been my first tip that something wasn't normal. So I said, oh, I'm just driving home. I'm almost there. And she's like, do you want me to wait until you get home? I was like, no, you can tell me now. And she said, we think it's Hodgkin's lymphoma. And I just said, oh. And she said, are you okay? Like, yeah, I'm fine. Everything's fine. And I got home, and I called my husband, and he came home, and we were very sad together, because we just knew that meant that everything would have to be put on hold. And I knew what lymphoma meant because my mom has non-Hodgkin's lymphoma.
Oh.
I think otherwise I probably wouldn't have equated lymphoma with cancer, you know, because when my mom was diagnosed with non-Hodgkin's, I don't think I initially realized that was cancer.
Like, understood. How old were you when she
so
was going through that?
We went to one doctor and we didn't like him. So we went to my mom's oncologist and we really liked him. And we started treatment relatively quickly. They didn't really stage me because they just wanted to start treatment, but I think I was stage 2. I had a lymph node in my chest that was the size of a basketball.
Oh my, what?
I know. And looking back, like, he was asking me my symptoms and stuff, or he was asking, do you have this symptom and this symptom and this symptom? And as he was saying them, I was like, oh, yeah, like I had night sweats and I was getting out of breath really easily, or more easily than I had been. I just never like connected the dots that there was something greater wrong. So we started treatment in February of 2018. And then I was done with treatment by May of 2018. It was very quick, but very emotional and very like intense in the midst of it. So I got a port placed in February of 2018, and they would deliver, I think it was ABVD. I think that was the 4-letter acronym. Through that every other week, and they were supposed to do it for I think 16 times, but we only ended up doing 7 because I was having such an adverse reaction to the chemo. So at the beginning, I had like the normal, like I would just be very tired and I would get sick after treatment.
Yeah.
Towards the end, I was getting sick like during the treatment, and the very last time I went, well, I guess it was the second to last time I went, they were trying to access my port and I was getting sick before then, just like in anticipation for what was going to happen. So my doctor was like, let's just not do it today. And they checked my blood work and I came in the next week and he said, your numbers are fine. You're not like, we don't see any cancer. We're just going to be done because this is about quality of life and your life is not quality right now.
Right.
So yeah, my treatment was basically cut in half because of that. And we were so thankful. Yeah, I don't know how I could have kept going. And my port was, I'm not sure if you had a port, but yeah, they told me that most ports, when they're placed next to or away from the scar. They put my port directly underneath my scar. And we used the port the next day after surgery.
Yikes.
So they had to go through the scar, and it took them over an hour to access it because I was just crying and it was so painful. They used ice and numbing spray every time, and it was still like the worst pain in the world. And I got the port out as soon as possible. I think I got it out in June or July, and I was done in May. So yeah, the only other thing that I really remember from treatment that really stood out to me from the Hodgkins is I was very scared, as I'm sure a lot of other women were, to lose my hair. And I remember after I shaved it off, because it was after the second treatment, because I remember they told me the first treatment stops the hair growth and the second treatment is what makes it fall out. And I was so nervous what my husband was going to think when he saw me. And I walked into the house after I got it shaved, and he just looked at me and said, "Oh, you still look like you." And that just like was like the biggest relief that he, yeah, exactly. So life kind of went back to normal after that, as much as normal can be after a cancer diagnosis and cancer treatment.
Yeah.
And then we were trying to get pregnant and kept trying and nothing was happening. And then I started using the Creighton model. Have you ever heard of the Creighton model?
No.
It basically tracks your cervical mucus.
Okay.
To help you get pregnant. Like based on how stretchy your cervical mucus is.
Yeah.
And so we were using that, and my cycles were super irregular, even more so than before because of the treatment. And did you have a question?
Yeah. So did they address your fertility at all with, treatment for Hodgkin's lymphoma?
They did. They gave me a shot of something. I think it was called Lupron, but I could be wrong.
Yeah, it is.
Yeah, and they told me how they explained it to me was it was going to just put me in a temporary menopause.
Yep.
I've learned other things about that drug since then that makes me wonder if that was the best course of action, but we're where we are now, so I'm fine. But yeah, they gave me a shot of Lupron to try to make sure that my eggs didn't get damaged. So I think part of the reason why my cycles were so long and so irregular still was I was still coming off of that Lupron. And so like my cycles were like 3 to 4 months long sometimes.
Wow.
Yeah, it was insane. They give you like a little chart to help you track your cervical mucus, and they give you like a month's worth, like 4 to 5 weeks worth. And I always like was going off the page and around the borders, and it was ridiculous. So I think it was like in December of 2019, my fertility specialist said, try this pill. I forget what it was called for the life of me, but it was she said, take it at this certain point during your cycle. I think it was either at like the time when my cervical mucus was like the most sticky, which means I'm in my fertile window. Mm-hmm. Take it at the beginning of that and see what happens. So we did, and then we did the necessary things to get pregnant. And we found out on Valentine's Day 2020 that I was pregnant. Yeah, my son is my favorite Valentine's Day present.
So sweet.
Yeah. I didn't even think I was pregnant. I only took a pregnancy test because we were going out to dinner, and I wanted to have a glass of wine, and I was like, I don't know if I should. Just in case, I'll take a pregnancy test. And my husband tells me that he heard the timer go off, which he knew what that meant. And then he heard me go, oh! And so we ran and we met on the stairs and we hugged and we were so excited. So I was a little sad that I didn't get to have that like that moment where I got to tell him I'm pregnant in a cute way. But I think that was pretty cute anyway.
Yeah.
So yeah, I was super excited. We were both super excited. We started telling like close friends a little bit before the first trimester was over. And then in March of 2020, I was at work. We had just had an appointment. Oh, wait, sorry. Let me go back. In March 2020, we had a follow-up appointment with my oncologist, just like a regular thing. And his wife, who is one of the receptionists, I guess she's a receptionist, she came in while we were meeting with Doc, that's what we called him, and put a file on his desk and said, we checked it twice, and walked out. And I immediately was like, what? But I didn't say anything, and Doc like kind of glanced at it, but didn't really say anything. So I just kind of like let it roll off my back, and that was it.
Yeah.
And so I kind of forgot about it until about a day or two later, I get a call from his wife and said, we need you to come back in. And I was trying not to overreact so much that I said, oh, that's fine. I'll come in next week. Is next week okay? And she was like, yeah, that's fine. And we hung up, and I was at work. So I went to go get one of my coworkers who was a really good friend. And I just started crying. I was like, what what if it's cancer again and we have to do something with the baby that we don't want to do.
Yeah.
We were so scared. And so I was like, I don't think I can wait till next week. I don't think I can. So I called Julie back, the receptionist, and I said, can I see him tomorrow? And without even hesitating, she said, yeah, I'll get you in tomorrow. We went back in and he told us it was chronic myelogenous leukemia, also known as CML. He told us it's not bad yet. We're not going to start treatment until after the baby's born. And I was like, that's great. That makes me feel so great. So we just kind of went on living. We just, he told me to stop working. So I left my job that I loved. I worked with foster kids and I loved it, but this was what was right. And I was going to leave after I had the baby anyway. I was going to be a stay-at-home mom. So it was just a little earlier than we had expected. So I left my job and I was just focusing on being healthy. And then sometime in early spring, Doc told us that he was closing his office. He was going to go to a bigger group that was further away. It's very hard to have a private practice oncology as far as I have understood. So along with that, my OB had told me when we told her that I had cancer, you should go to Penn State because they know about this stuff and we don't. And I was like, right. Thank you for being honest. That makes me feel so much better. So I went to, all around the same time, I went to Penn State's OB. Around the same time, I was also trying to figure out what I was going to do for an oncologist because I genuinely needed one. And we did my initial blood work, and the doctor, the OB at Penn State said, this seems worse than you are telling me, like based off of your blood work. Let's get you into Penn State Oncology, which is like one of the best cancer centers in the country as far as I have heard. And let's get you meeting with one of them and see what they say. So we did in like mid-May 2020. So this is height of the pandemic. Yeah. When we found out I was pregnant, like it was just like around the world was the pandemic. They hadn't even come to America yet. And so we go in, we all have masks on, and we do our blood work and all that stuff, and we leave. We had met with the oncologist. He was pretty optimistic. And then we get a call saying, so this is a lot worse than what you were saying. You're in blast crisis, which I guess is the stage, like a stage of CML. So there's like stage 1, stage 2, and then blast crisis.
Oh.
And so it has, I never really understood it. I just kind of heard it's bad and just went with it. But I went back in that day and went inpatient. I was admitted to the oncology floor. I had never been admitted to a hospital before in my life. I had never had a surgery before, besides like like in and out procedures, you know?
Yeah.
And it was COVID. So, and like they didn't know what they were doing. So my husband couldn't come in with me. And I was just terrified the entire time.
Of course.
I was so thankful. No doctor in the entire time that I was pregnant and in the hospital ever even mentioned termination. And I'm not sure if that was just not like they just knew it wasn't necessary, or they just knew that we didn't want that. Like that was not, right. Even if they had suggested it, we probably would have said no. Like, unless I am on death's door, no.
Right.
So where was I going? I'm sorry.
You were just admitted.
Oh, yeah. I was just admitted alone, and they don't know what they're doing with COVID. They don't know any of it. So I'm in on the oncology floor. Oh, I'm sorry, my cat. Um, this is the loudest cat I've ever had, I swear. So they admitted me to the oncology floor, and after a day or two, I have a symptom of COVID. Just one. They don't bother testing me. They just sent me right down to the COVID unit. And I'm like, I am pregnant. I have cancer. What are you doing? So I was in the COVID unit for, I think, 2 days before they realized, you don't have COVID. You can go back up to the oncology unit. So that was fun. And yeah, I was discharged about a week before I turned 27. I turned 27 at the end of May, and I was discharged then. And yeah, it was a crazy time. I kept going back in and out of inpatient every couple of weeks. I think I had 3, maybe I think 4 inpatient stays for chemo before I had Caleb, who is my son. Wow. And he was born on September 23rd. I went in for a routine visit with my oncologist in mid-September, and they looked at my blood work, and they had said, based on how often I was going in for the chemo, they said that we're just gonna hold off on chemo, we're gonna skip a cycle basically, so that you're not high up on chemo, you're not super sick from chemo and all that other stuff when you're giving birth, because they were gonna have me deliver 3 weeks early. They were gonna have me deliver at 37 weeks instead of at 40 weeks. They were gonna induce me, and we're gonna do that, and then after that you can have chemo. But at that visit they decided you need chemo sooner than that, so we're going to induce you at 36 weeks instead of 37 weeks, and then you can start chemo a little bit earlier. So I got admitted at 36 weeks, and man, I talked to some women who've had babies since. My sister-in-law just had her baby. She was in labor for 36 hours, and she pushed for an hour and a half. And I was in labor for 18 hours, and I pushed for less than 15 minutes. And I felt so bad when she told me how long she pushed and how long her labor was. I'm like, I'm just not going to tell you about my birth story.
I think you deserve that, though. I think you deserve that.
I know. That's what I've said before to a couple other people, that God gave me so much other stuff that happened during my pregnancy that he just gave me the easiest labor possible. They couldn't give me an epidural. I didn't want an epidural, but they couldn't give me one even if I had wanted one because of the other medications I was on. But they did give me a pain med through my Hickman. I had a Hickman for my second, for the CML, a double lumen Hickman. And so it was one of those buttons that you press to administer the drug. And they had told me, press it at the end of a contraction and it will start working by the beginning of your next contraction. But the way that my contractions were working, I think with the induction, how the medication was working with the induction, it was just my contractions were so close together. They were back to back to back, and it was very painful. I just couldn't press the button fast enough. Wow. And so I was in a lot of pain, but they ended up figuring it out, and I was stuck at 6 centimeters for so long. It was I think most of the time I was in labor, I was stuck at 6 centimeters. And then I fell asleep magically. I guess the contractions got better, but I don't know how I fell asleep. And then I woke up at 6 o'clock in the morning, and I leaned over my husband, and I was like, I feel like I need a push. And he's like, okay, I'll go get a nurse. And he got a nurse, and she had me do a practice push, and she went, "Oh, you're ready."
Oh.
And so she ran and got the doctor, and I had to hold back my pushing because I just felt the need to push so much. And I think, including the practice push, I pushed 3 times and he came out.
Amazing.
And he was so small. He was under 5 pounds, and
Wow.
he was almost 19 inches long.
Wow.
I know, he was like a string bean. And yeah, he was very cute, but he went to the NICU shortly after because of, I think it was glucose levels. And then he ended up staying because he was having issues feeding. I couldn't breastfeed for obvious reasons.
Mm-hmm.
And so he was having trouble taking the bottle. So they kept him. The first time we went to go visit, it was like ships passing in the night. A nurse was coming down to tell us that he had a feeding tube at the same time we were going up to see him. So we got there and he had a feeding tube thing in his nose, and we were so scared. But he was, but it was fine. It was fine. He was good. And we felt so bad being in the NICU because he is having trouble feeding. And on one side of him is a little baby who they're talking about open heart surgery. And on the other side of him is a baby who has a colostomy bag. And then there's our little guy. And I was so thankful when they moved him from the NICU to the continued care unit, which was like right next door. It was just, it's for babies who are like him. He just have a little problem, not enough to be in the NICU, but enough that he can't go home yet. So he was in the hospital for a total of, I want to say 11 days, not quite 2 weeks, which they say is a lot less, or is less than what most babies are in the NICU for how long. And then less than a week after he got out, I went back in for chemo. And that was one of the hardest things, to leave my newborn son who just came home from the hospital. And my husband's a rock star. He did it all. He was mom and dad when I was gone, and it broke my heart that he had to do that. But he's a great dad, so he did great.
How long were you in when you had to go for chemo? Like, how long was your stay?
I think like 4 or 5 days. So not quite a week, but close to it. Yeah. It was longer than I wanted to be in.
Yeah.
And then after I had him, I started getting like fevers pretty bad whenever. So I also had, I have in my head, it's called an Omaya. I'm not sure if you've ever heard of that. I had never heard of that. They had done a what's it called? A spinal tap. They had done a spinal tap when I was pregnant still, and they had found some of the cancer in my spinal fluid. So the Omaya is basically a port that goes to your spinal cord. So every so often I would get chemo, and they would test my spinal fluid through this, so they wouldn't have to do a spinal tap every time they did that. And every time, like 2 or 3 times in a row, I would get that done, and I would get fevers, like crazy fevers that I would have to go inpatient for. And I ended up, because of that, I ended up missing his first Christmas.
Oh.
Between that, so I had the fever leading up to Christmas. I came home, and then I was also taking oral chemo, and the oral chemo gave me really bad lung problems. So I came home from the stay before Christmas for the fever on Christmas Eve, and then later that night on Christmas Eve, I started having breathing problems. I couldn't catch my breath, and so my husband had to take me back to the hospital on Christmas Eve, and I was in for another week, and I came home on New Year's Day. It was like, everyone kept telling me, oh, it's fine. He's not going to remember it. He's not going to remember it, but I remember it, you know?
Yes.
Yeah. So that kept happening. We got the Omaya problem under control. They decided that, again, they hadn't seen chemo, or they hadn't cancer in it for a while. So they were going to stop doing the chemo, but they were going to keep testing it. So they would still have to tap it, but it wasn't going to be as invasive. So that seemed to help with the fevers, but I was still having the breathing problems from the oral chemo. And I remember the last time I went inpatient for a while was right before I turned 28. Like the week leading up to my 28th birthday, and then I was discharged, and I promised myself I would not go inpatient the entire time I was 28, and I made it until November 2023. So over 2 years I had gone without going inpatient. So I feel like I beat my record. But yeah, so yeah, that was and then the big thing that happened was in February 2021, I got my bone marrow transplant.
Right.
Yeah. I don't know how I missed that. But it
just blocked it out.
yeah, right. So yeah, in February 2021, I went inpatient and I had my bone marrow transplant on February 26, 2021. So as we're recording this, that was this past Monday. So I had my third rebirth day, which was fun. And I don't know how much like the people listening to this know about bone marrow transplants, because I didn't know much about it before I had it done. It's basically an immune system transplant. Like I have a fancy new German immune system because my donor was a German male. And like I know that no one who's listening who has had cancer can be on the registry, but everyone who can be on the registry should be on the registry.
Yes.
Because it's so easy, to get on the registry. You just have to do a cheek swab. And then once you are on the registry, the likelihood you're going to get called is pretty slim. But if you do, it's just you get an injection of something that stimulates your bone marrow, which I have had. It's makes your bones achy, but it's not really that bad. And then they just draw blood. And then they filter out the bone marrow or the stem cells. Bone marrow and stem cell transplant are the same thing. And then that's it. And then you save someone's life. I think it's crazy the amount of people who are not on the registry or don't know about the registry.
I think that's it. I don't think people are aware as they should be.
Yeah. But some man in Germany who I will never meet. I have emailed him since. Aww. After a year, I could email him. So I emailed him some pictures of me and my family. He emailed me some pictures back. I had 1,100 perfect matches. Wow. And that is an insane number because my old boss at my old job, her brother needed a bone marrow transplant. He had 8, and they thought that was insane how many he had. So 1,100 is not like astronomical in that world. There are some people when I was watching Dancing with the Stars around the time that I had my bone marrow transplant, and Nelly, I think it was Nelly, was on.
Nelly.
I know, right? And his sister died because she didn't have a match. Because statistically, African Americans are less likely to have a match. Germany, it's like a civic duty to be on the registry. But how many people are going to like places like Africa, like rural places in Africa, to get people on the on the donor list? That's probably not happening. So it's really sad. So if you are a minority, and you should get on the list, especially because I think there's significantly less people. I'm mostly German, so I think that's why I had such a high like match list. But yeah, at least once a year I get all preachy and say everyone should get on the list, because
Of
I
course.
feel like I had 1,100 perfect matches, and that's not fair.
Now, take
Like,
us through the actual transplant. Like, I don't know exactly what you experienced. So
yeah.
what was that like?
Yeah, so that's another thing that people like you said don't know. I didn't know, because I see on I watched an episode of House, I remember back in the day, and they're like pulling this bone marrow out of this kid and he's screaming. That is not what it's like at all. So a bone marrow biopsy can be painful, but that's just to test bone marrow. That is not to actually do the transplant or to get your bone marrow for a transplant. If you're donating. So I went in, I think it was like February 18th, and between the 18th and the 26th, I had I think 2 days of full body radiation. So I would go down to like the radiation unit, and they had previously to me going inpatient had made like 2 molds of my body in like this mat. It's hard to describe, but and so I would just lay perfectly still. They would ask me like, what do you want to listen to? Like, what kind of music? And so I would tell them what I wanted, and I would just lay there for 10 minutes on one side, and then I would flip to the other side and do 10 or 15 minutes on the other side. And I did that, I think, twice a day for 2 days, I believe. And then I did, I think, a day of chemo. And then it was so anticlimactic. They had all these people coming in to sit with me during the actual bone marrow transplant, and they brought in just like a bag that looked like really thick blood, like light colored thick blood, and they hooked that up, and they hooked it up to my Hickman, and they just let it go, and that was it. It was just like getting blood. But it's insane because the aftermath, the after effects are very similar to getting an actual like organ transplant, from what I've heard, at least. I went from the day before the transplant being able to walk up and down the hall perfectly fine, not needing to rest at all, to the day after I could barely walk half the hallway without being out of breath. My energy levels just dropped like a rock. It was insane. And I got neuropathy pretty bad that lasted well after I was in the hospital. And yeah, it's been 3 years, and I'm still working my energy levels back up to where they were.
Wow.
And I mean, part of that is I just was like, oh, I'm just going to relax and not really, I'm just going to give myself a break because I just had cancer. But I think the more you like push yourself, the better it is in the long run, because I think I'm dealing with that now. But yeah, and then I had to wait for my numbers to bottom out. And they say numbers. I don't know what numbers they were. They were some blood levels, but I don't know what they were. And then they had to wait for them to come back up to a certain point. So it took longer for them to bottom out than it did for them to come back up. I was discharged, I think it was March 11th or 12th. It was before St. Patrick's Day for sure. And yeah, and then I was home. And then I was dealing with all of the after effects because everything was different. I was going back into the hospital every other day for checkups and blood work and all that. So even though I was home, I wasn't home a lot.
Yeah.
And the Penn State is an hour from my house. So it's, yeah. And there are people who come from further too. So I like, as annoying as it was, it wasn't as bad as some people have it.
Right.
So yeah, I came home and I had a lot of learning about my new body. My skin is completely different. I used to have oily and like combination skin, and now I have dry and sensitive skin. That was interesting. I had to have my gallbladder removed. I ended up having 2 gallstones that took up basically all of my gallbladder.
Wow.
Yeah. So now I take Protonics, which is basically an antacid every morning
Yeah.
before I eat anything to help with the pain. Like, otherwise, if I eat any fatty foods, I'll be in a lot of pain. The same pain that I was in before I had my gallbladder removed. I'm now in menopause, which is fun. We
Not
we
fun.
tried. No. We knew going into the bone marrow transplant that there was a decent chance that I was going to lose the rest of my eggs because it's full body radiation.
Mm-hmm.
So we looked into saving my eggs. We did a lot of the injections, and when I went in to get like the eggs checked to see how it was going, and they told me we might be able to save 1 egg. And for the price of it, we just weren't willing to take that risk.
It's so
because
expensive.
it's so expensive, and that 1 egg may or may not become an embryo.
Right.
That 1 embryo may or may not freeze well. It may not thaw well. It may not implant well. So I had gone to that appointment alone, and on my way home, I kind of made up my mind that it wasn't worth it and that adoption was the way to go for us. And when I got home, we cried. We mourned that loss, the loss of the ability to have another child. But we know that Caleb is a miracle child. After that appointment, we knew he was our last chance to get pregnant ever. Because
Yeah.
if I had waited, if we hadn't gotten pregnant that time, that was it. I would have been diagnosed a couple of weeks later, and that would have been it. So he is our miracle baby, our biological miracle baby, and we know that there is a baby waiting out there for us that God has perfectly picked out for us. And I've said a lot. So faith is very important to my husband and I and our family. And I've been saying for a while, since we found out that we couldn't have any more kids, that I know that when I meet the baby that we are meant to have, I will know that it has all been worth it. If God has the perfect baby picked out for us, and if I had to go through all of the cancer, all of the stuff to have that baby that he has planned for us, I think it will have been worth it,
Yeah, absolutely.
And yeah. And that's like, it's hard to say now because I'm like, I hated cancer, and I will still have hated cancer afterwards, but I will know the reason why.
Yeah. Yeah, I think that is a big thing for a lot of cancer patients. You have to find a way to make what you have been through almost worth it, or find some kind of purpose through it. And so I love that you have found that through your faith and through your child and soon, eventual children. Yeah. So I'm glad that you have found that way to make it make sense.
Yeah. My faith has been really important to me through both of my cancers. Each cancer, I feel like I've had a verse and a song that has really and a worship song that has really resonated with me. So my first cancer, the verse was, "I will walk by faith even when I cannot see."
I love that.
And I liked it so much that I got it tattooed on my arm with my cancer ribbon for that cancer, for the Hodgkins. And the song that I really liked during that time is called "Seasons" by Hillsong Worship. And then for my second cancer, Esther, I think it's 4:14. Maybe I was made for a time such as this. That I really love that verse during my second cancer. And the song was called Rattle by Elevation Worship, and that actually came out in January 2020, and I was diagnosed February 2020, and there's a lyric that says, live, live, dry bones, hear the word of the Lord. And in my darkest moments in the hospital, I would listen to that song and I would just plead with God, let my bones live.
Yeah.
And then we actually went to an Elevation Worship concert in May 2022, and they sang that song, and it was so cathartic to scream at the top of my lungs, live.
Yeah.
Because my bones were alive now, you know?
Yeah.
I get emotional just thinking about it.
Of course, yeah.
Other side effects. I had a hip replacement. Yeah.
How did that all come about? Oh my gosh.
So I said that I had breathing problems from the steroids. The steroids gave me osteonecrosis because I was on them for so long.
Right.
Osteonecrosis basically means bone death. I had never heard this before. And so my hips, they were eroding basically. So my left hip was replaced in September, and I'm probably going to need the right one replaced at some point, but we're trying to put it off until after the adoption, which who knows when that will be. At least until next year, hopefully.
What did you were you just having hip pain and got it checked out? What was...
You would be surprised how long it took to figure it out. So I started having hip pain in my left hip a Halloween weekend 2022. And I was like, this is so weird. And I had a cold at the same time. And I knew that you can have joint pain with colds sometimes. So I was like, maybe it's just that. Whatever. But then it never went away. And I had mentioned it to my oncologist, and she is an oncologist, so she knows about the steroid use and the osteonecrosis, and it did not faze her. She did not think of it at all. And then I went for a CT scan for something unrelated. Mm-hmm. I think it was just like in January, it was just like my yearly annual CT scan, or like a scan that I get for just to check that I haven't gotten Hodgkins again or any CML has come back. And in the scan, she saw my hips looked weird. And so she asked for an x-ray, and she sent that to the doctors at like the local Bone and Joint Institute. And yeah, that they said that my left hip was too far gone. They couldn't save it. But my right hip, they tried a procedure called, I forget the name of it, but it's basically they took some bone marrow out of my pelvis, and they, for lack of a better term, drilled a hole up into my hip bone and inserted the bone marrow into my hip bone. And it was supposed to promote bone growth.
Right.
And it worked a little bit. It didn't work a lot. It worked, like, they started to see some bone growth after like 2 appointments. And then the next appointment, it started collapsing again. So they said there's nothing we can really do now. And I have stopped seeing that doctor, but that's because he said, you don't need to see me until you're ready for a replacement, until you think the pain is enough that you can't deal with it anymore.
Oh my gosh.
So yeah. So those are the main side effects that I've had, but it's been crazy to me that I've been done with cancer. I've been cancer-free, no evidence of disease since my bone marrow transplant 3 years ago, and I'm still dealing with the side effects. Yeah. So while I would never in my life tell a Hodgkins lymphoma patient that they have a good cancer, because that doesn't exist. Right. Hodgkin's was my good cancer. My specifically good cancer. If I had to do it again, I would have chosen to do Hodgkin's twice and CML not at all. But still neither were fun. you know.
You have been through an insane amount of things, from both cancers, fertility, your hip, your gallbladder, all these things. That is so wild. How have you, I have like a twofold question, because, you know,
Okay.
as like a parent, as a mother going through all this mentally, I know you hung on your faith a lot, but what were your, in the moments, what would you lean on to try to make it through? Because I know it's so hard being away from your child, and then also just feeling like you lost this, it's your first child, you know,
Yeah.
I'm sure you felt a sense of like that, like your first experience as a mother was altered, you know? So how did you get through that in the moments?
I know I've already touched on it, but it's really my faith. I would just pray to God. I would just think, man, at least I have him. Like, if there are so many moments that I would think that I can't do this anymore. I can't go through any more treatment. But then I would think, like, I can't leave him without a mother.
Yeah.
Like, I need to do this for him, if for nothing else. In recently in the fall, I went back inpatient for like a couple of other like minor things that were just like back to back kind of things. And we went to the ER. I had an infection, and they did I think a CT, and they saw something on my lungs. And without calling my oncologist, the ER doctor said that it's suspicious of lymphoma. And it was the first time in my cancer experience that I've heard someone tell me that I possibly have a cancer, and I just started bawling because I didn't think I could do it again.
Yeah.
But after like reflecting on it, I know I would. I know I would, because I had to be there for Caleb. I cannot leave him. He's 3. I can't leave him without a mother. We tell him we're going to the hospital, and he says, the doctors are going to heal you. God's going to heal you. And like, I can't let him down. I can't let him believe that that's not true.
Yeah.
So that's what I think of when I think of giving up, or think of how to get through it. I just think of him, and that I just gotta.
Yeah, I think our kids, you know, have this, you know, obviously as parents, we always want to protect them and keep them safe and do right by them. But when going through these situations, at least they're almost like this, the driving factor for everything. You know, it turns into more, it gets more serious in the sense of, you know, we just have to get through for them. And they kind of, in turn, because of that, I think it like takes a little bit of weight off, because it's, you know, we have this purpose for a drive. We have this reason to get through. And so I think it's just like this like mutual beneficial situation where, you know, mama bear comes through and has to, you know, take care of her cubs. And I love that he was that for you.
Yeah. And kind of what you were saying about how like Robbie, it's definitely very hard for me when I have a friend or someone on my social medias who says they're pregnant, and I just think it's not fair. Yeah. I did not get a normal pregnancy for 2 reasons, because I was pregnant during COVID and I was pregnant during cancer, and it just doesn't seem fair. But then I think they don't realize how much of a miracle their baby is, and I know without a shadow of a doubt that Caleb's a miracle.
Absolutely.
And my husband and I were talking the other day, we have to be a little careful that we don't give him a big head, because with all the miracle talk, but it's true. Yeah.
Now, because you also went through COVID while you were going through all this, you didn't have anybody with you during your treatments or hospital stays, right?
For the most part, there were brief periods of time here and there where they were allowing visitors and not. So we actually went into the bone marrow transplant thinking that I could not have any visitors, because the last time I had been inpatient, I couldn't. They had I guess someone on the floor had COVID, and so they were locking it down. But I got in and they were like, oh yeah, you can have one visitor for your stay. So like Sean could come whenever he wanted, but he was the only one. Yeah, where I think the normal rules, like outside of COVID, are you can have one person per day. So like Sean could come one day, and then like my mom could come the next day, but like they couldn't come the same day. So it was a little different, but yeah, it was definitely difficult. But I mean, I hated that Caleb had to go through that experience with me being pregnant, but it was also almost nice in a sense because it was COVID. I never really felt alone because I would feel his little kicks and I'd be like, he's right here with me. But yeah, so it was also very weird the first time I went back in for chemo when I wasn't pregnant. It's like, I feel like I'm missing something.
It's different. Yeah, I felt the same thing. I felt like, wow. I mean, I was happy. I was so happy.
Yeah, exactly.
Like, it was just like you're on your own. Like, I don't know. I totally understand that experience, which is such a wild experience.
I know.
Now, did you I always bring her up, but were you aware of Dr. Cardonic when you were going through all this? Dr. Elise Cardonic? No. Or do you know
I don't think I've ever heard of her. So no.
This is the second time I'm bringing her up in one of these conversations, but she was just such like an angel in my experience. She's an MFM doctor, but she has a study or a registry that she holds for people who experience cancer and pregnancy. So
I think I've heard of the registry.
Yeah. So she follows, women and then their children to try to, follow them along their journey so they have more answers for people like us. And so I'm always just curious to see, because I was able to ask her a lot of questions that nobody knows, because nobody deals with pregnant patients going through all of this.
Yeah.
So it was definitely such like a little light in my situation. So just curious.
Yeah, I heard about it after I was pregnant, and I have like emailed her or whoever is like you email to get on the list to start the process. I keep forgetting and haven't actually done it yet. But it's something I definitely want to do. And they said that it's not too late, even though Caleb's 3 now and I don't have cancer anymore.
Well, as you said, all of these things, it doesn't really end.
Yeah, true. Very true. Yeah.
Yeah, I'm glad you mentioned that, because again, that's a reason why we're talking about this, is because while there's active treatment and all these things that you're doing to kill the cancer and do all those things, like so many different things affect you because of cancer afterwards. It goes into all of your decisions. It goes into, a lot of your medical care and et cetera, et cetera, et cetera.
Yeah.
So do you find yourself thinking about it a lot with everything you've been through, like in terms of your anxiety and, your mental health?
For a while I did. I struggled with not with my faith, but like how to align what I believe with what happened to me.
Yeah.
And so I worked through that a lot with a therapist, and he was a good therapist for that time because he asked me a lot of questions. He just kept asking me like how everything relates back to everything that I've been experiencing. So I've kind of boiled it down to, I don't think God gave me my cancer, but he also didn't take it away for a reason. And that kind of goes along with the adopted baby. Once we get that child, I'll feel like it's all worth it. So all that kind of like works together. But I feel like my husband, who is obviously my primary caregiver, he has so much more anxiety than I do about it. I think just watching me go through that and just feeling helpless. But every time I have a cough, every time I complain about an ache, he gets anxiety and he is scared what's going to happen. But it's gotten better. It's obviously not 100%, but his anxiety levels are better now than they were a year ago.
Yeah.
But I find I have less anxiety. I don't know why. I guess I'm just at a point where whatever is going to happen is going to happen. And I try not to think about it too much until someone tells me you might have lymphoma.
Yeah.
Yeah.
Mine
Yeah.
too, because you do have to get to a point where you're just accepting that what will be, but also you have to be, aware of your body, and, you have to like maintain that balance of being aware, but also not being so aware where you're freaking yourself out. And it's really hard
Yeah.
to live in that space.
Yeah. I had a PET scan a couple of weeks ago, as like my annual, like I said, with the CAT scan from 2 years ago. It's just like to check to make sure the Hodgkins hasn't come back, everything's normal. And this time it was also to make sure that the thing that they saw in my lungs in November wasn't still there. And no one called me after the PET scan, but I got like in my like my chart or whatever it is, I got like the words of what they found. And in the lungs part, there was nothing. And then it said something in like the thymus part. And I was like, I don't know what this means. No one's called me. So I am choosing not to freak out about this until someone calls me or I meet with my oncologist. And I have met with my oncologist since, and she didn't even know I got the PET scan, which made me feel good. But she said it's probably not cancer because it was calcified, and most times cancer doesn't manifest itself in calcification. And I also was starting to have a cold when I got the PET scan, and she said that could be a reason why it was bigger, or like the thymus was bigger. So I'm getting a CAT scan in May.
Okay.
On my birthday.
No.
To check. But she's
Happy
not
birthday.
concerned. Yeah, exactly. She's like, happy birthday, here's a CAT scan. I can't have breakfast on my birthday. It'll be great. But yeah, I'm not concerned until someone tells me be concerned. That's how I choose to deal with it, I guess.
Excuse me. Yeah, absolutely.
That's okay. I have the same thing.
It just hit me out of nowhere. Yeah, absolutely. Because otherwise you're going to be it's that why worry twice thing, you will deal with it when it comes. So we'll be definitely thinking about you in May for sure, but it's just a standard follow-up.
Thank you.
Right?
Yeah, exactly.
Excuse me.
Oh, you're okay.
Right. So thank you so much for, sharing your story. It is a wild one, and I'm really glad that you put it out there because, somebody at some point is going to potentially be in your shoes. And I think, it's such a unique experience where they will need to hear it. So thank you. I appreciate that.
Yeah.
And would you be willing to share information so if anybody does want to reach out to you, they could?
Yeah. That's totally fine. My Instagram, I think it's little.holst, HOLST. Let me check just to make sure because I recently changed my name. Yeah, little.holst. I don't think you can message me unless you like request to. I have my Instagram relatively private, but if you message me and say like I have cancer or I want to talk to you about your cancer journey, then I will always say yes. I'm always willing to talk about that.
I'll put your information in the description as well, just so anybody can reach out if needed. And again, thank you. And do you have any like words for somebody who potentially will be in your shoes in the future that you could lead, that you wish you kind of would have said to yourself in the beginning of all of this?
That's a great question.
That's a heavy, large question.
Yeah. God's got this. That's what I would have said to myself. God's got this.
Put it in his hands. Love that. So thank you again. I really appreciate your time, and we will see you in the next one.